First item on the agenda is update from the county emergency response team on COVID-19. So we'll go to either Patrice Lambert or Tom Berger, whichever one would like to go first.
This is Patrice. I can begin unless Tom wants to. Not hearing Tom, I can begin. Thank you, and good morning, everyone. Again, I always just start by identifying our Dubuque County Public Health Incident Management Team, which consists of Tom Berger, our EMA, Stacy Killian, our Director at the Visiting Nurse Association, Mary Rose Corrigan, City Health Specialist, and myself. We continue to meet on a daily basis, per phone, if not twice a day or more as needed. We also work closely with our Iowa Department of Public Health, probably in conversation with them at least once a day, if not more. So with that, I just wanted to start with, I'm sure everyone was aware of the increased testing that we have had in the state of Iowa and the total confirmed cases, which is right now, as I speak, 3,641 positive in the state of Iowa. Total people tested in the state of Iowa, 27,615. Total deaths are 83 in the state of Iowa. And then in the state of Iowa, the total confirmed cases recovered are 1,293. And then for the county of Dubuque, we have 48 total confirmed cases. Total people tested in the county of Dubuque, 856, and we have one death, and we are still at 15 for the total confirmed cases that have recovered. We have had much attention through Iowa Department of Public Health and with the media with outbreaks that are reported from meatpacking facilities. They've brought a heightened sense of awareness to the work sites, and especially all of our larger employer work environments that are involved in manufacturing and production. And Monday, I believe I had shared that, and I believe it's in the packet, we did include, we worked with Rick Dickinson, which we truly appreciated, in getting information out, and also worked with the chamber. And then we did send out letters to our grocery stores in the county that they all work closely with the local work sites. And we really wanted to target on those larger employers to make sure that they have the information that they need for their work site health, and so that they understand the new absentee reporting requirements. So I don't know if you had a chance to look at what Rick had sent out, and also the grocery store letter that was sent out. And we're really zeroing in on preventing outbreaks in the larger manufacturing, well, basically the larger employer work environments. We're asking them to implement measures to enable the social distancing as much as possible, encouraging the flexible work from home and leave policies, staggering shifts if at all possible. We are asking that they review procedures to identify ways to increase the physical separation of their staff. We are working with the Iowa Department of Public Health on their new guidelines, and those guidelines that they have set up, the Iowa Department of Public Health, is a reporting system for employers to report more than 10% absenteeism for their work site, and that's utilizing the COVID-19 screening recommendations. And then in the county of Dubuque, as well as all of the counties in the state of Iowa, if a work site outbreak does occur, Iowa Department of Public Health will contact us, the Public Health Incident Management Team, personally to give us any guidance if we need to conduct testing or contact tracing to that work site. So I hope everyone did receive a packet and you could see the information that was sent out. And also, as I said on Monday, we are going to have the communicable disease nurses or a staff member at the Visiting Nurse Association do periodic calls to different larger manufacturing and actually smaller work businesses in the county just to do a pulse check to see how they're doing, if there's any questions, concerns, if there is anything that we can do to help them at their work site. So that is up and running. And then we're also looking at, well, basically, you'll be getting the reports from the subcommittee chairs, which we have worked closely with Chris Corkin. I just heard her voice a little bit ago with our brain health, and I know that she's on the agenda. And Diane Freiberger is going to give an update on the testing sites component as well. And she then did also ask if she could report on the testiowa.com. So I will leave that information up to her. I saw an article last evening, and for the life of me, I cannot find it, but they had reported on how many actually completed that assessment since the governor had announced it at 11:30 or 11 o'clock yesterday, and it was a large number. And just so you know that the public health instant management team is trying to get that website, or that, not the website, the testiowa.com out to as many groups as we can, because we're encouraging people to complete that assessment in hopes that we will have additional testing done in Dubuque County. But I'll let Diane Freiberger report on that. And then also, Susie has just been amazing with the fabric masks. She can report on that as well. And let's see, I think that's pretty much all that I have right now. And if there's any questions for me during the committee reports, I will be glad to assist as needed. And basically what we are telling people is to continue to stay home as much as possible, practice that social distancing, limit those trips to the grocery stores and the other grocery or the other stores itself, and only go for the necessities. You know, if you can, only go out once a week with only one person in your family to do any of those errands that have to be done. But we really are encouraging, because the Region 6, as you know, does have stricter mitigation measures that prohibits gathering. So we're really trying to tell people, please just stay at home. We can get through this, and we can get through this together. So that's all that I have.
Any questions for Patrice?
This is Diane Heiken. I do have one.
Go ahead, Diane.
Patrice, thank you. Patrice, I have a specific question about the contact tracing and people in production facilities. And this was brought to my attention, by another individual in the community, and they wanted me to ask this. Are we considering the possibility that someone that tests positive, maybe when they're going through their interview on the phone with the communicable disease nurse, isn't specifically clarifying that they do work at a production facility, but they're working through a temp agency? And so maybe there's a miscommunication that people that are employed with temp agencies, that's who they work for, that's who their paycheck comes from, but they're placed in a production facility. And so possibly we're missing that connection to a production facility. Do you understand what I'm talking about?
Sure. And Diane, I'll have to double check with the communicable disease nurses, but it would be my understanding, the survey or the assessment form that they do complete. I am guessing that the communicable disease nurses that we do have in place are very thorough, but I can't speak specifically to your question, but I can follow up with the temp agency. But I would guess that yes, they probably are doing a thorough investigation, but I'll double check and I'll shoot you an email.
Yeah, thank you. I did review the form. I know it's on page 2 where they talk about employment and occupations, but I'm just, yeah. So I'm a very literal person, and I'm just imagining somebody who's, they're sick. Now they have to leave their job. Maybe English isn't their first language. They're going through, a lengthy interview. So I just think we need to talk to those nurses about that, because from what I'm understanding, that's a possibility that we could have something fall through the cracks. Thank you.
Sure. I'll be glad to double check.
Other questions for Patrice Lambert? Okay, Patrice. I'm guessing there'll be additional need for your input, so we'll move on to Tom Berger for his report.
Good morning, everyone. Just to let you know that we did get another shipment in from the state yesterday, which provided us some much-needed isolation. Spent the afternoon getting them out to the long-term care facilities. So we're sitting a little better than we were. Obviously, I think it's catching up a little bit, but as of right now, we have all our requests are filled. We'll be circling back. We did get a order of Clorox wipes from a local vendor this morning, so we got to circle back and see who was requesting them. But the requests have slowed down, as I think that kind of goes with the hospital census and everything else that's happening. So other than that, that's really what I have. If you have any questions for me at this point.
Any questions for Tom Berger?
Ann McDonough. First, thank you for everything that you're doing. My question is really just trying to think outside the box. It sounds like our requests have slowed down. We have the items that we need. That's wonderful. But we also know that our peak or our surge is still anticipated. And so just wondering, and I know you do all the checklists and everything, but one last, consideration. Is there anything that other communities have told us that they should have thought about or would look at differently if they had the chance? Just am looking at is this the calm before the storm, and is it time to do one more thing if you have that opportunity?
That's kind of how I'm assuming it is, Ann. So we're trying to get ready with our stock and still trying to figure out the exact numbers, but it's tough to figure out. We did have a call about the still trying to figure out the KN95 masks that they work, and on the long-term care facility meeting on Monday, they talked about the need for fit testing, which during a PPE shortage, the fit testing, we're trying to follow up on that with the state and what the recommendations are, because you'll burn through quite a few masks in doing the tests with them. But I mean, it is important that the healthcare provider have the tests. So as far as what other communities have seen, I do get a few through our International Association of Emergency Managers, kind of some best practices and such, but nothing real specific for Iowa or Dubuque County yet that I can apply really. Or I mean, we can apply it, and we're still we know that we're going to be going through N95s and still trying to procure them locally. So.
Thank you.
Okay. Other questions for Tom Berger? Okay, hearing none, we'll move on to next item on the agenda. And by the way, thank you to Tom Berger and Patrice Lambert for their leadership and all their experience is helping to guide us through this, and it's much appreciated. Next item is item B, County Operations Response Plan. The first item is Board of Health update. So I will defer to my counterpart, Chairperson Tom Beschen of the Dubuque County Board of Health. So Tom, I'm going to turn the gavel over to you.
All right, thank you, Supervisor Baker. I would first off like to start by indicating that there are 4 members of the Board of Health on the call today: myself, Diane Pape Freiberger, Diane Heiken, and Susie Stroud. So we have 3 items for discussion this morning. The first is a brain health update, and Chris Corkin has graciously agreed to provide that for us, so I'll turn it over to Chris.
Okay, thank you. And again, thank you for all the work you guys are doing, and thank you for letting me speak today. As you probably know, the Dubuque Foundation, Community Foundation, has had 2 committees in existence for a year, a couple of years for the adult and 6 months for the children's brain health. And we've been working recently, in light of this crisis, on a weekly and biweekly basis. We've obviously set aside our kind of standard ongoing agendas to focus on crisis management. In terms of the adult brain health, and I've attached some of our minutes, we've been looking to touch base with all of our providers as well as consumers in terms of what do people need right now, and secondly, what's working and what isn't. And so we've had 2 meetings along this line, and we've gone through pretty much everyone except our next meeting will include the jail, the homeless, a representative from the Homeless Coalition, as well as we're looking to get the psych triage folks from Mercy Hospital to see there what's happening. But we've been very pleased with the response, and particularly in light of working with providers in terms of how they've had to revamp their reaching out into the community. So we've been very pleased with that, and I've included the minutes in there for you. For the children's brain health, which has always been more project-based, we started a project which we're actually right now very proud of. We put together they refer to it as a bookmark of crisis numbers, as well as just a couple of basic crisis tips, with the idea of getting them out to families who were participating in the food supplement programs. So we put together numbers that we thought were significant, and we, through the graciousness of the Board of Supervisors, we used money from the grant they previously provided to the Community Foundation for operational expenses. We were able to pay for the cards through that money, so thank you to the supervisors. So we didn't have to dip into COVID funds. And we got the cards out this week to Western Dubuque schools, Dubuque Community Schools, Boys and Girls Club, and we've contacted a couple of the other food dissemination sites, and we haven't heard back from them. We had the cards done in English, Spanish, and Marshallese, so that they could be, used by as broad of a population as we thought we could reach. And since we've done that, people have found out what we're doing and have asked to expand. So we've now also sent it out through the entire Head Start network, which is a very significant network. And we've been contacted by other agencies who've asked if they could use these cards as well. And of course, we said yes. There's nothing proprietary about them, and it's good basic crisis information. And so we've been very pleased with that project. The cards we have in hard copy, but we're also providing them to anyone who's interested electronically. So if people want to get it out through their network electronically, let me know, and we can get you the information as soon as possible. One of the things that we were particularly interested in with these cards is, with the kids being out of school, the child abuse reporting numbers have gone way down. None of us believe that means there's no longer any child abuse going on, but because kiddos aren't in a place where other people have eyes on them, this has been of concern for us as well through the brain health and the children's program. So we're particularly interested in pushing that information out, the child abuse hotline number and the awareness through the schools as well as through law enforcement. A couple other things that we've been able to provide. You can see the card up on your screen right now. May Hinchin, who is the CEO of the of our region, East Central region, and also has been very valuable to us, provided a packet of information that was created by the Polk County region, which is a region in and of itself. They pushed out to everyone saying, use it, tweak it, make it your own. So I included that and sent that to Patrice. If there's anything in there that that you feel is worthwhile, please feel free to use it. Or if you have any questions about it, let me know. We've also are very interested in pushing out Rachel Williams, who is the child prevention specialist employed by the foundation, had put together an kind of a primer on ACEs, Adverse Childhood Experience, kind of an online primer for people who are interested, which is extremely timely right now. Most of our teachers through WD as well as Dubuque Community have had access to this, but not all. We believe all of the counseling and nurses, counseling center personnel as well as nurses in the schools have, but we thought this was a very good time to get this out in general. So I included that in the packet as well. The program is set for the 30th between 1 and 3. The information I sent out has Rachel's contact information for registration. She informed me yesterday that even though it just went out yesterday, and through word of mouth, that they've probably maxed out on this session. So she's looking to set up a second one. So I would recommend getting that information out for anyone who is interested. And then I want to touch base quickly before I finish on a couple of things that we've learned in this that I think are valuable and will be valuable in the future. And one is the value of telehealth and telemed. Most of our providers have gone to telehealth. I believe the jail is using it. Law enforcement is using it in place of face-to-face mobile crisis calls. Individual providers have used it, and it's been received very well. So I'm thinking into the future, once even we're beyond this crisis, that will be something that will be a part of how we do business. Ironically, what we're finding is that the kids love it. Children who are seeing counselors or therapists are very comfortable with telemed, which is actually no surprise because their lives are online. So that's actually a good plus. The other thing we've learned is an equity issue as well as a brain health issue, and that is access to internet. Once we get through this, we're going to have to relook at how we can provide better broadband services to our community. Schools are struggling with it for families that don't have private or personal internet sites in terms of getting school information out. We're finding it with providing health services, so that's one thing to keep in mind. And the other, kind of hearkening back, one of the projects that the Brain Health Group had been working on for about 3 to 4 months is how to clean up and then push out 211 to the community because we felt it was underutilized. Well, this crisis, because it's a crisis, has focused on 211, and now that the community awareness, I think, has been resolved. People are now much more aware of 211. Once this is over, we will go back to continuing our project of cleaning it up, tweaking it, making it a little more user-friendly. But the awareness is out there. So that's a huge plus because I think that's a very valuable service. And then finally, particularly, I want to thank the supervisors, again, for the grant provided to the Community Foundation, allowed us to pay for these cards and get them out quickly without much fuss. So that was very valuable. So thank you for that. Also, thank you for getting the money for the IHH program for the jail. This was an enormous gap in our services for the brain health community within the jail population. It's been a problem that has prevented us from moving forward successfully. So thank you for going to the region and getting that money. That will solve a lot of immediate problems that we were having that were unresolvable. And then thank you for your efforts to get a 10-hour-a-week psych nurse for the jail. I know that wasn't successful. However, ironically, when we put this proposal together, Hillcrest and the jail, Captain Menster at the jail, and ourselves were trying to be as responsible as possible with only asking for 10 hours. We felt we needed to be good stewards of taxpayer dollars. We didn't want to say we want a full-time nurse when we thought we could get by with less. And ironically, at least from what I saw in the paper, one of the questions was, well, why would we do this if it's only 10 hours a week? Well, we made it 10 hours a week because we thought we were being responsible. We may have to relook at that, or at least retry it, because a psych nurse availability in the jail would be very valuable, provide some nice cover for the medical treatment. We do have good nursing service in the jail, but having a psych nurse on site, or at least available 10 hours a week, would make things much more efficient, particularly in terms of med management. They couldn't prescribe, but they could make recommendations based on their contact. So I thank you for trying, and we'll keep working on it. But that basically covers my portion. We contacted Patrice with the idea that we've got these existing brain health committees, adults and children, for lack of a better word, and we didn't want to form another committee because we don't need another committee, but we wanted to be a good conduit to the Board of Health and the emergency management process in this time of crisis. We wanted to feed you people good information, because there's lots of things out there, particularly on social media, that are not good. And we also wanted to be a voice for, if there were questions generated from your end, back to us, so that we could address them without taking up your precious time and then get information back to you. So we see ourselves as a conduit more than an actual separate committee for these issues, in terms of getting a good, solid, valuable information back and forth. So that's what I have.
Chris, this is Diane Pate Freiberger.
Hi, Diane.
I have one. It's an excellent presentation, and I am really pleased, with all the work that you're doing. I just have a question. Todd Lang, who is on the Board of Health, has he been in on any of your conversations?
Oh yeah, he's a very active member of our brain health group, and he's always a very significant participant in the process. So yes, he's a big part of what we do.
Chris, Dave Baker, talking about the initiatives put before the mental health regional board last Friday. Mm-hmm. Obviously, we're happy with the IHH, and that was a fund balance request.
Correct. Right.
The other was the psych nurse was requesting that the region put that in their budget. That come from their the regional dollars, which some of those are dollars. But my read, and Supervisor McDonough can jump in. I made that motion, didn't get a second. There was, I think, the discussion about the 10 hours. To me, that was a criticism, I guess, that maybe we weren't doing enough, but that person also didn't second the motion. So my read, and I'll defer to Supervisor McDonough, is that there's a lot better chance of the board approving our Dubuque County fund balance dollars than the mental health region dollars. It seems like they're pretty protective of that, and that's just what I walked away from that meeting. And that may not be any big news, but that was the read that I got.
Frankly, Dave, in reading between the lines, which I'm always leery to do in just getting a newspaper article, that's kind of the impression I got as well. But
well, if I might just, Supervisor McDonough speaking here. Dave, I appreciate very much that you were able to cover that meeting for me, and we got hit with an unknown to us governing board technicality that Dave was not officially designated as an alternate. I mean, we're still, to some extent, trying to fully engage as a board with the governing board for mental health. So we're all still working on that. But the Lynn County request for their psychiatric nurse, there's a few distinctions, and one of those is that they did start doing that as a fund balance project themselves. So that's kind of the preferred method, right? That you spend your own dollars, find out whether it works or not, and then you go back and ask for it to be part of the regional funding. But some of it is timing too. And, you know, Chris, you and I have talked about this. How do you get in the budget? How do you get to the governing board? How do we get that line item extended to our county? And we were late. We missed the window to get this in the budget with the full push of the CEO. So it will come back. We'll get it. I think it's a great project for a fund balance project. You know, we need an update about what fund balance money do we have available,
Right.
And where, who's drawing down what funding, how much is Hillcrest drawing down for their the crisis program that we decided we would fund on an interim basis. So a lot of things, but I think we'll be back at this. I would like to see the jail and the committee continue to get ready to do that. I think we're going to have a work session with Hillcrest about this in more detail. But I have another question for you, Chris, and this relates back to Todd Lang. Todd is, of course, a regional, statewide expert in peer support.
Right.
Where when you make that call, a person in crisis, you are connected to a peer, someone who's lived your experience, someone who's living with mental health issues. And, you know, we've talked about the value of telehealth and telemed. I'm wondering if there's been a push to use that teleservice and the expansion of it to support and communicate really the results that we receive when we use peer support. That telesupport for
Right.
peers, I think, would be, and Todd, I know, is not with us
Right.
on this meeting call, but any
I can-
update there?
I can check with Todd and get back to you. I know he is very aggressive, and I don't mean that in a bad way, with pushing peer support and creative peer support delivery, for lack of a better word. So it wouldn't surprise me if they've kind of worked on that, but I don't have a specific answer for you. I can check with him and get a specific answer. I know he has been very, vocal and active in all of our brain health presentations. So he may have an answer for us immediately. If not, I can get back, have him work on it and get back.
Right.
But we've been so pleased with the success of the telemed. And, there was pushback and maybe inertia when we talk about telehealth issues, and we were like, I don't know, is it going to work? Will people like it? Well, in a crisis, we've had to, and it's really been, I don't want to say wildly successful, but way more successful than we could have ever hoped. And as I said, from all kinds of, from everything from the jail to the police to Hillcrest is doing a lot of telehealth. Individual providers are doing it telehealth with their clients. So that's really been one of the really good kind of silver linings in this. But I will check with Todd and get back to you guys.
Thank you, Chris. We just have tremendous county-wide people working on issues before us and difficulties. And, in my time on the board, we have just really stepped up to the mental health issues and the strategic partnerships we have funded with the Community Foundation have been very successful, in my opinion, for our citizens. So thank you, Chris. You lead that very well.
Well, and thank you. I don't want to beat a dead horse, but we couldn't do this without the Board of Supervisors' support. Not only financial, which is obviously very important, but also kind of intellectually and from a commitment standpoint. This will be very hard to be, banging our heads against a wall without the support of the supervisors. And we've never had a moment where that we have not felt 100% supported by what the supervisors are doing. So the only way we can really do this successfully is to gather the people, get out in the community, and with the Board of Supervisors support, it makes it much, much easier. So that's all I have. and unless anybody has any questions, but thank you for allowing me to present.
Thank you, Chris. The next portion of the Board of Health would be the update by Susie Stroud on the cloth mask distribution. And that committee has done an awful lot of work in 2 weeks. So with that, I'd turn it over to Susie to give an update.
Thank you. Good morning, everybody.
Good morning.
Good morning.
Everybody hear me okay? Okay, good. As of this morning, with another early morning delivery, I've handed out 4,665 masks, me and members of this committee. So I think that's just since like Thursday. So I think that's incredible. We took on a delivery of 1,500 more masks from Right Height. Thanks, Ed, for that. And they were delivered by Diane Pape Freiberger to the West Campus. I received an email from Dubuque Community School District, Joe Maloney, who's doing logistics for the grab-and-go meals. They would prefer any more masks be packaged in Ziploc baggies, 4 masks to a baggie, with a flyer. And I coordinated with Patrice and Dawn, and we're getting Dubuque County employees to package those up. So I delivered another 500. So there was 2,000 masks and flyers delivered yesterday morning to be packaged up so we can those more masks to Dubuque Community School District. They've handed out 700 so far. I believe the spreadsheet was shared of all the places we've been. So we're hitting big organizations, and one of the connections I made was with the United Way. So we delivered like 165 masks to Ecumenical Towers, which is exactly the kind of population we're looking to focus. People that still have to go out for doctor's appointments and get medications, but may have disabilities, may not speak English as the first language, may be elderly. So that was great that we were able to do that. In talking with United Way, they offered up the Get Connected services for volunteers. So we are going to have a drive up, walk up mask handout at Key City Creative Thursday, Friday, and Saturday, keeping social distancing in mind, and volunteers will be wearing masks and gloves. And Jess Bladley over at United Way is setting up the volunteer list, and she's going to give me a spreadsheet. So anybody is interested in helping out with that, email me and we can get you connected. We're looking to get 2 to 3 volunteers per hour, so we're not overcrowded and we can maintain that social distancing. But on last Saturday, Diane Pape Freiberger and Diane Heiken did a table out in front of Key City, and in 2 hours they handed out 125 masks. And it was mostly people walking by, indigent ambulatory populations that are under-resourced, and so we know there's a need. So we're going to try to do that, and we're looking at hours, not in the middle of the day, but to be able to offer to give these masks out for people that may be doing shift work or may not be available during the day. So Thursday, we are doing 1 to 4, Fridays 2 to 5, and Saturday is going to be 11 to 4. So we're going to keep tracking and seeing how many we can hand out. We still have about 5,000 masks to hand out that are being stored down at Key City, maybe 4,500. I could be off about 500, but we got enough to hand out. I want to give thanks to Randy Gale's office at the city. Within 24 hours, they had the layout for the flyer and also had it translated into Spanish and Marshallese. So this weekend we did a Staples order. So I had flyers available Monday morning to hand out. Some of the other specialized populations that we've targeted, I've given 250 masks out to 3 different leaders of the Marshallese community to get those out. I handed 150 to someone assisting with the Guatemalan population and getting food and supplies to that population. I know there's in the works a meal delivery system, collaboration between Project Root It, Resources Unite, and Taj Suleiman from Dubuque Community School District to get meals to more Marshallese families. And when that's all figured out, we're going to get masks to them along with the flyers. So we've done a lot in a couple days, and we're hoping, I'm hoping that we can get most of these masks handed out within another week. I'm also doing a delivery this afternoon to Crescent. They're going to get masks into some of their patients' hands, ones that still have to come in for appointments, but they're mostly doing telehealth. There's only a handful of patients that are going to Crescent at this time. So I see people are giving me their phone numbers that they can help. I'm going to put my email in the chat. If it's not too much, if you could email me, and we can talk that way. And that's my update for now. If anybody has any questions, feel free to ask, or suggestions, or some place that you think I need to target.
Hi, Susie. Ann McDonough, thank you for you're just hitting the ground on this, and I appreciate that. And you're working tirelessly on this, and you're incredibly organized, so I appreciate that very much. Your email address just came up in chat. I'm going to stretch the conversation to go to the entire county, and I know that we have different folks working on masks in Cascade, and that those communities to some extent I think are kind of taking care of their own cities. But do you have are you attempting to do any coordination with them? When you leave the city of Dubuque, frequently the city clerks are kind of the hot center spot for communication and for, communication with the citizens. And also just wondering about Mercy One in Dyersville, have we provided them with the opportunity to have masks? So, stretching beyond, of course, the very vulnerable populations here in Dubuque and the general population, but I know we have folks countywide who could use access to the mask with instructions.
I know you can't see me, but I'm shaking my head. Yes, that's one of my weak areas, is getting out into the county, and I fully admit that. One thing that is helping me is Whitney with Project Root It does deliver meals out to Western Dubuque and Farley, and she has taken and delivered masks to those food sites. Mm-hmm. But if people have connections out into the county, we can get masks out there. It's one of my weak spots is out in the county. So if anybody would like to help me with that, that would be great.
I don't think it's a weak spot. I think we'll just build on where we are. We have some pretty solid coverage happening in the city of Dubuque, and we'll just develop the network that we have. And I think Diane Pate Freiberger has been in contact personally with folks in the Cascade area, and she may already be working on these things and may know where there's some identified needs. I'm happy to help as best I can as well, Susie. So thank you for what you certainly have a great handle on the need.
Thank you. I have sent a couple feeler emails to people I know in Piasta and Epworth, but that's as far as I got. So yeah, if people can help and connect, that would be wonderful.
Susie, this is Diane Pape-Freiberger, and I have made contact with Representative Lundgren in Piazza, and she got slammed just like the rest of us yesterday with this Test Iowa stuff. But she is checking what location we could use, who actually needs them, if there's a need out in their community. She's going to get back to me on that. And I know that Key City Creative's mother, Tim's mother, has made 300 and if we cannot get them out of the county stockpile, she would be willing to donate them out there also. And I know that I've made contact with Sageville, and they are covered. And I have also talked to someone in Dyersville, and I plan on taking some more out there.
Great.
Excellent. Thank you.
And Susie, a comment to you on the flyer. It's excellent that it's been converted into the Marshallese and the Spanish. And actually, after I checked with you, that was sent to Hormel yesterday, or day before, I don't know days anymore, 2 days ago. And they actually posted it in the Marshallese and the Spanish right next to the English, the directions for the masks and how to make their own if they do not have one. But Hormel is giving the employees masks if they do not have their own cloth mask. And I also, after checking with you, had talked to BNA, and they are using them also. So it is great that we've had them translated and that we are being able to reach more of a population in Dubuque County.
Yeah, I got to hand it to Randy's office. I mean, I gave him, Taj and I gave him the information. He did the layout. And then when they got the translation, he revised the layout to fit with the different languages. And seriously, it was so quick of a turnaround. I was really impressed. And it's a great resource to be able to have at least 3 languages. It shows that there's that effort there, and we know of some of the barriers, and just make life just a tiny bit easier for people that don't speak English as their first language.
Okay, if there's nothing else for Susie, thank you very much, Susie. Very good update and a very successful project. Okay, the next topic for the Board of Health was testing update, and Diane Pape-Freiberger has agreed to update us on that.
This is Diane Pape-Freiberger, and I am going to be reporting on the testing site and also a follow-up on who is paying for, if the federal government pays for the COVID-19 tests. And also I will give a summary of Test Iowa. At the end of my summary, I'm going to give my opinion on what I saw as barriers to this Test Iowa. Okay, to begin with, happy Earth Day, everyone. Please get outside sometime today and enjoy it. Okay, related to the testing site. Okay, that'll come next, Dawn. Thank you. The chair of the testing site was unable to meet with Diane Heiken and myself. That chair forwarded a summary to Patrice to share with us, and this is as follows. We have determined how to monitor and decide when the community test site would launch through regular reporting of testing occurring in the community and regular meetings. We have identified core staff for working at the clinic. We have set up the Wi-Fi for the site. PPE is here and available. UCL, United Clinical Lab, has set aside test kits specifically for the community test site. There's no number given there. Training will happen later this week, and the site will be reviewed by logistics team later this week. Because we were not able to have direct conversation with this individual, I did send an email with this question. What is the threshold for opening the remote testing site? In other words, what is the criteria, the numbers that will determine when the remote site is going to be opened if it needs to be? We have not heard back yet. A question arose on Monday at the Board of Supervisors Board of Health meeting, who pays for the tests for COVID-19? I sent emails to staff for U.S. Representative Abby Finkenauer and staff for U.S. Senators Chuck Grassley and Joni Ernst. I received a timely response from the staff of Representative Abby Finkenauer stating, the Families First Coronavirus Response Act, which is the second package, provides for free coronavirus testing for the uninsured. It appropriated $1 billion to the National Disaster Medical System to reimburse providers for the costs of diagnosing and testing uninsured individuals. Providers have to register with the National Disaster Medical System to get reimbursed for providing these services and to get reimbursed for and the conditions is that they need to be on Medicare or Medicaid. When the person does not have health insurance, the insurance company will be billed for the amount of the testing. All right, is there any questions on either of those items? I'm just giving an update. I'm not an expert in this. I'm just reporting back what I have heard. Okay, with no questions, I will, now Dawn, you can put up that screen, please. Okay, I am going to give an update or a summary of what is Test Iowa that was launched yesterday. Test Iowa is a new initiative in partnership with our state leaders and private corporations. The goal is to dramatically increase the rate of COVID-19 testing so Iowans can have better access to testing and help stem the spread of COVID-19 to get us back to normal as quickly as possible. And my personal opinion is I think the normal is going to be different in the future. And the next item would be, why is it important to consider testing? And I will address that later in this presentation, in this summary. The next thing is, how do I get tested? The first thing you do is you go to testiowa.com. And that's on the computer. You go to testiowa.com. Drive-through test locations can accommodate up to 3,000 tests per day. From what the governor had said yesterday, within 180 days, 540,000 tests will be available, and up to 3,000 tests. Currently, the sites for testing, effective today, there will be opening a test site in Tama, and on Saturday, a test site will be for the general population in Des Moines. And those sites are on the Test Iowa website. With the assessment, that's the first step. They look at symptoms, travel, and exposure. And I did go ahead and I went in and I registered myself. The state of Iowa has stated that the information provided on the assessment and demographics will not be provided to the public and are secure. In the event a person is tested positive, the patient's name, test results, and other information will be reported to the Iowa Department of Public Health as a reportable disease. So the first step would be to do an online assessment, again, at Test Iowa, which is one word, .com, not .gov, but .com. Once you complete the assessment, you will be given information whether you are eligible to get tested, where to go, and will receive a code number if you are tested positive to go with you to the test site. Currently, as I said before, today they are opening the test site in Tama, and Saturday they're going to open a test site in Des Moines. If the person qualifies for testing, they will need to see a local health care provider to get tested if they do not want to travel to one of those test sites. Now, again, this initiative started yesterday, and they want to be able to open them up throughout the state. So for today, unless you wouldn't want to go to Tama, or on Saturday go to Des Moines, you would have to see your local healthcare provider to get tested. Healthcare professionals and those working in long-term care are priorities when getting tested. Next priorities are those with symptoms, and the next would be in essential manufacturing. The assessment is a 7-page questionnaire in English, and I bolded that. There are no options to choose a different language. Also, some of the health options are medical terms that may not be understood by the general population. Towards the end of the assessment, it does ask questions regarding the number of persons living in your home, broken down by age groups, and if needed, does the person need, if they are tested positive, would they need another place to live during that time frame that they are symptomatic, and for 7 days after that. The assessment does ask a question, what type of industry a person works in, and if they have traveled. If a person has symptoms, but not severe enough to be eligible to be tested, they will receive daily emails asking if their symptoms have changed and what to do if their symptoms have changed. And they are looking at down the road setting up a telehealth for these individuals to be able to have health care through a telehealth during that time frame. It can change. When a person does the assessment and they're told that they are not eligible yet for testing, but their symptoms increase or have changed, they can, at a later time, be eligible for testing if the symptoms meet the criteria. Okay, if a person is eligible, a note will pop up and ask you if you want to be tested. If yes, you're directed to one of the test sites. Or, like I said earlier, a person may want to check with their local healthcare provider to get an order, back to the physician order is required for these tests. A person can complete the assessment more than once. So if you have no symptoms now, you've completed the assessment, and at a later time develop symptoms, you can do the assessment again. Now, I completed the assessment, like I said earlier. I have no symptoms and I have not been exposed, to my knowledge, to a person who has tested positive, have no underlying health issues, but I am eligible for testing because I'm a nurse. So I'm set as a priority. The plan is to increase testing as noted in the very first step of Test Iowa. The goal is to get everyone in Iowa to complete the assessment. I agree more individuals need to be assessed and tested, but individuals in Dubuque County who complete the assessment and are eligible for testing would need to go to a test site or go to your local healthcare provider to get tested. We could be doing more testing here in Dubuque County and accomplish the goal. All test results are sent to IDPH and are in the state data that is compiled. That's whether you are tested through Test Iowa or whether you are tested through your local healthcare provider. If a person tests positive, no matter which, if you're doing Test Iowa or local healthcare provider, contact tracing will be completed. And this, I need to know, criteria for testing remains the same as previous state hygienic lab priorities. That it has not changed other than a few exceptions, which is where healthcare providers are given the priority, and then they take a look at if you are symptomatic, those that are the sickest will get tested next. And then they're looking at where someone works. If they work like in a meat packing plant, or if they are a long-term care provider or a healthcare provider other than that, they would also be priority. And there still is the 48 to 72 hour turnaround time is what they're projecting for the results. My concerns are all information is English. There is no option to choose a different language. There is an assumption everyone has a computer or access to one. The language and terminology used may not be understood by the general population. Testing sites are not centrally located, and additional sites are currently being set up around COVID-19 outbreaks. In promoting Iowans to complete the assessment, the state cites 75 to 80% of all patients with COVID-19 either have no symptoms or have minor symptoms. Based on the information that this assessment and testing is critical, and that the importance to testing are, as stated on the site, the sooner we can identify COVID-19 cases, the sooner we can get back to our normal life. In addition to social distancing, widespread testing is a proven effective way to combat the spread of COVID-19. Testing gives us a crucial date that we need to track the spread of the virus, contain it, and help to find a cure and save lives. That was off the state website. I think I've been stating that for a while here. But anyway, I refer back to the motion that was made and carried by the Board of Health at the combined Board of Health Board of Supervisor meeting on the 8th of April, that testing needs to increase in Dubuque County. Currently, Dr. Vanderheiden has stated that there are 18,000 collection kits, test kits, available in Dubuque County, with the possibility of more after the valuable reagent becomes available. I would like to see more testing start now in Dubuque and not wait for an outbreak to qualify Dubuque to participate in Test Iowa. From what the governor stated yesterday, places where people complete the assessment and a need is identified, more testing will become available. And I know that another goal of Test Iowa is to complete serology, which is the antibody testing down the road. But from what I understand from Dr. Vanderheiden, they're not real sure on the validity of the test kits that are out there on the market now. And apparently FDA is approving companies to go ahead and put these serology tests out, but they've never been proven with a population, some of these machines. So there's a question on how quick we actually jump into doing serology testing. Barriers to increase testing now. A physician still needs to write the order. Okay, and Patrice and I clarified this with IDPH. We got the answer back this morning. Or a physician could write a standing order, like at the remote testing sites, where people that come in could be tested that qualify. And when the samples are sent to the state hygienic lab, the criteria and priorities must be followed, which also limits who we can test. Okay, are there any questions?
Diane, Dave Baker, I had a question. We've been calling for additional testing here from Dubuque County, and all of a sudden there's a change. I'm happy with that. How do we? I guess wouldn't our healthcare providers, the doctors, nurses, CNAs, support staff, technicians, etc., from our long-term care facilities, our medical providers, our hospitals, clinics, wouldn't they be the first one? Shouldn't they be the first ones on the list to get tested?
Dave, this is Diane Pate-Freiberger. According to Test Iowa, they are first. They take priority at this point. But we don't have Test Iowa. We're in Iowa, but it's not here in Dubuque County. Unless from what I understand, what was reported yesterday and last night, unless there's an outbreak, we're further on the list of Test Iowa coming here. So what I'm going back to is the motion that carried on the 8th of April that as Dubuque County, and we know we have 18,000 with the possibility of more with the reagent coming, tests, that we start using them. And I know from my conversations with local healthcare providers, the physicians refer back to United Clinical Lab to see how many test kits, and we don't want to just burn them up. You know, you want to have some available in case you have a surge, in case you have an increase in numbers, in case you need to test a broader community, you want to have some. But when you have 18,000 available, do we need to reserve all those 18,000 for that? A lot of this goes back to the criteria at this point, but and I checked into this with the Mayo Clinic, their criteria is not the same as the state hygienic lab in Iowa. So it's all in where United Clinical Lab is sending that. Whoever is running the test, not collecting the test, but running the test is the one that sets the criteria.
Yeah, this is Supervisor Wickham, and Diane, I appreciate your report, and I fully support your proactive approach in testing. I think that is a good next step. We need to do as much as we can to see if we can fulfill those testing commitments in Dubuque County. Ed, I know you're on the line here. Ed Raber, I know you've spoke to UCL staff and kind of also studied the governor's new testing programs. Do you have any comments or updates?
Yes. Thank you, Supervisor Wickham. I am in regular contact with Diane Pate-Freiberger, a person that I've never met, but we talk multiple times a day. And I've also been in contact with several of the other boards of health members that are keyed in on this particular issue, as well as Dr. Vander Heiden. I've also had an opportunity to have a conversation with Gary Collins, CEO at Crescent Community Health, very recently. I think I agree with what the assessment that Diane just provided to you. Thank you, Diane. What I've been doing on my end is trying to understand this. What are the nuances about how this is operating, what it means? Been fortunate to have some interaction with Representative Shannon Lundgren, who has been in contact with the governor's office, trying to understand where is the spaces for us to maneuver, where are there opportunities for Dubuque County, because I concur with what Diane just said, that we're down the list of hotspots. There's 10 counties that have a lot more cases than we do. And if that's the push for the first, as the state called them, tent test sites, that will be weeks out. They see this as a 6-month thing. So trying to figure out right now, is there an opportunity for us to partner with the state? Could we set up our own affiliate of that? How can we make this happen quickly? I think one of the things that Representative Lundgren sent back to me just this morning was, again, saying in no uncertain terms, we need to get people in Dubuque County to go to www.testiowa.com, take the assessment, if for no other reason than just to get into that database. The fact that the first priority that the state said, as Diane reported, is first responders, medical community, long-term care employees. That's what we need to be pushing out today. I know that the incident management team meets with those people on a regular basis, daily basis perhaps. We need them to be telling those employers, those leaders, that they need to get all of their employees to take the assessment now. And in parallel to that, figuring out how do we get something going here in Dubuque County. Does that have to be at Grand River Center, the test site? It's wonderful to hear that they have planning and training going on right now this week. Diane said that we don't know the threshold yet. We hope that community will tell us what the threshold is, and that if we don't meet that, is that something that just getting more testing going in Dubuque County, can that just happen in the parking lots of the medical providers where they're doing it now? But in the last month, we've only done 700 tests in in Dubuque County. And we'd like to, I think the message that I'm getting from the Board of Supervisors and the Board of Health is that they would like that to move up. And what do the nuanced new priorities from the Test Iowa thing, what is the nuances? There's a number of things to be teased out there, and I'm working on that with those partners.
This is Supervisor McDonough. Ed, I'd like to have you add to your list of things that you're looking at cost. With every conversation, you have to drive down to find out who's paying for the test. How much does a test cost? Does anybody know? We don't
Correct.
have funding to test every person if it's all at the county's cost, right? And
Correct.
if you look at the Test Iowa site, it says, you know what? You use this site, you get tested. There's no public money to pay for this. There's not even the public health in Des Moines. It's right there. If you're recommended for a test through Test Iowa, you're making a contract with Test Iowa, which is a private analytics company out of Utah, I think, right? So, I mean, we got to make sure that we're not confusing citizens about who's going to be responsible for the bill. Is it $300? If you have no insurance, what's the cost? You don't have Medicaid, you don't have Medicare. That was part of the report. You don't qualify. Now what? So what's my copay? So every time you talk about this, the zero has to be on, I need to communicate costs. So, to open up our remote site, testing site, that is something I hope we do that someday. Right now, every indication is that we have capacity through our providers, but a physician is not going to give a standing order to get tested for somebody if the physician doesn't know whether or not people are going to be compensated. Does medical associates get paid back? So,
Right.
I mean, there's really a cost-driven factor here, like everything in our medical system right now. It's always about who's got the money and who's spending it. So, I know Supervisor Wickham is going to say it's not about cost, not about
No,
cost.
it is. No, you're exactly right. It is about cost and about using the taxpayers' money to help keep them safe. And
Correct.
that is our primary role.
Right.
We collect taxes. We have tens of millions of dollars available at our ability to keep the public safe. So yes, we do want to know costs. We want to understand exactly what it costs, but do not let that be a barrier. We have the taxpayers' money. We've collected it. We're in a pandemic. We should apply all the leverage we have to get the people the testing and the safety that they need. Right now, the cost should not be a barrier, but we should understand it. I fully agree.
Okay, so the other thing that I understand about the Test Iowa is that, again, we're working with a company that is pursuing analytics. So questions are, Ed and Diane, when will we know how many Dubuque County citizens get registered? I did the assessment last night. Even on your cell phone takes, 3 minutes maybe? No surprise, I'm not going to get tested either. Perfect. But they have my information and I can update it. And if more and more folks in our community go on and do that, then we're driving that pool of information. And if a hotspot, they're going to be drawing through technology. I think they've got my zip code, they've got my street address. Now they can start to see, do I need to be contacted for an emergence that's maybe happened? I mean, I'm delighted to see us get to this level where we're starting to use technology to draw us together and to show group linkage. Like, okay, folks where you've been, they can start to draw those connections. I would like to see more information about the process beyond a test site or not a test site, but what's the purpose of the information? When will it be shared back with us? Because it's a great communication tool to aid our public nurses who are trying to do contact tracing. This could do that in the real world with some real, oomph. There's ability here to carry this if it's going to be used that way. So I'd like to know those questions. I think that would be helpful information as well. I think it's creating a database, but I do think that before we tell people that tests are widely available, we want to make sure that we tell them that they need to get registered with Test Iowa to help us know the parameters of what's needed, if that's true, if that's what the Test Iowa program is going to do.
Correct.
And this is Diane Pate-Freiberger. Back to the barriers that I see using Test Iowa. The language is only in English. Okay,
Correct.
So right there we're excluding a lot of individuals, and then they're assuming that people have computers. That's also excluding a lot of individuals. I'm afraid that they're looking at a specific population and not the whole state of Iowa. Because you can't be looking at the whole state of Iowa, because we do have immigrants, migrants, that do not speak English. And that is why I believe it would be great if everyone gets in and does the assessment. But even if everyone in Dubuque County did the assessment, we're still excluding those populations. And that's why I would like to see us moving ahead from a county standpoint.
This is Ed Raber. Supervisor McDonough, I totally agree with what you had said there. I have been asking questions about what's the cost, who does that, and further, and I haven't, there's some conflicting things because, as you pointed out, there is a private company. Are you making a contract with them? I think the state had allocated $26 million for this initially here. I saw that in a quick news thing this morning. And the governor in her presentation yesterday said that if you're tested through Test Iowa, there is no cost to the individual. So that's a very simple statement to make. Trying to understand the back.
If that referral goes to the state hygienic lab.
Correct.
Right. So you got to follow through the sequence to where the test actually is performed.
So we don't have that information yet, and I've been working with Dr. Vanderheiden at UCL Labs to kind of get a better understanding about that, and he is unclear of even how some of those nuances are. So that is an answer that must be presented, and we do not have that yet. And I'm hopeful, I share the concern that Diane just brought up. I'm hopeful that each successive day that we'll learn more from the state about those questions, as well as that we'll see that English-only assessment site be rolled out in multiple languages. We may have to do something locally with our, perhaps with our friends in Blackhawk County that also have a Marshallese population, to see if we can get that relatively simple 3-minute test translated into Marshallese too, so it could just be on the website that way.
Might it be that we could contact, maybe if Teresa's still with us, but ask Iowa Department of Public Health? I mean, does the company intend to make further changes to make it available in other languages? You know, I don't think they're intending to oversight anybody. They're rolling it out as quickly as they can. Maybe that's coming later today. That would be, you know, the thing to follow through before we make our own version of it. Let's try to find out whether there's going to be recast and it's going to be updated.
Right. We'll be monitoring that throughout the days and throughout the days ahead to make sure that that happens. I'm sure that that's a concern that's shared by a lot of your colleagues around the whole state. So that's one of the big flags, is that it was just English only right now. But I'm sure that's just for the initial rollout. But we'll track and push on that.
Thank you.
And I appreciate all the things that the Board of Health and others, and Patrice and her team are doing. not me.
Okay. This is Tom Beschen. I appreciate the conversation. I agree with Supervisor McDonough that, while this may only exist in English, it's a start. We've got to start building the database. I understand that we need to get it out to other communities that don't use English as their primary language, but let's at least get a start. Okay. Are there any other questions right now? Can anybody hear me?
I can hear you, Tom.
Okay.
I hear you, Tom.
All right. Okay, I didn't know if I was working or not. Okay. Any other comments on the testing? So we'll continue to stay in touch with Test Iowa and see where this is going. Okay, that's all we have from the Board of Health today. Dave, other questions for the Board of Health?
Tom, if you don't mind, and I kind of saved this for during the Board of Health part of it, but we have I was had a few people contacted me about our golf course at Fillmore being open, and I actually drove by yesterday on my way back from Cascade, and there's a bunch of cars in the parking lot. There's carts out on the course. I'm assuming social distancing is being practiced, but I can understand people's concerns. We're asking people to stay safe at home, shelter in place, and the golf course looks pretty darn busy. So I wanted to make sure that we were being proactive in getting word out to our citizenry about the need for exercise and the practices that are in place. So Brian Preston is on, and I'm going to ask Brian to jump on and talk about things such as the golf course, some of our other parks and recreation and conservation areas, and campgrounds. So if it's okay with you, I'd like to have Brian Preston jump on for a report.
Okay, yeah, that's fine with me. I saw some of the emails last night, so I appreciate the addition to the agenda.
Hello.
Sounds like you're ready to go there, Brian.
All right, so just real quickly, we've had extremely high use in all of our areas, and just some statistics, we put out counters to kind of keep track of how many people are visiting. In less than a week, we had over 500 vehicles that were at Whitewater Canyon. So that's a 650-acre wildlife area with trails. So family, people have been out hiking. We have had park rangers out patrolling, especially on the nice days, to make sure that people are observing the social distancing. To this point, we haven't had any issues. Just on the Heritage Trail, this last weekend, in 2 days, we sold about 120 annual passes. So we have, that's probably 5 times what we usually do in a typical weekend. So the increase is phenomenal. We are open some of our campgrounds on a limited basis. We have a sheet that people can apply for a permit for people that are in town doing construction work. The governor sent out a letter to contractors stating that this was available to them. We don't have to participate in it, but Highway 52 project, we have a crew in that just came in to pave that section of road. So they are in the campgrounds. We have signs posted to let people know that recreational camping is not allowed. They are talked to by our staff before they arrive. They have to apply for this permit before they arrive. They just can't show up and start camping. And that they have to, socially isolate while they're there. And we do not have any of our restroom facilities up and running. We do have some pit latrines that are open. All of those are equipped, clean daily, and have hand sanitizer in each one of them. So my opinion was that the use was so heavy, if we don't provide some sort of restroom facilities, we're going to have other issues to add on to this. So the golf course has been open since late March. Number of practices that we're employing out there. You can't golf unless you're a member of the same household. We have had a lot of families come out golfing. We have separated the tee times by double. So every other tee time we wiped off the schedule, so they're more spread out. So we have less opportunity for them to bunch up at a tee or anything like that. So any questions for me?
Brian, Dave Baker, on the campgrounds, I understand that we have construction projects, and I understand the governor, I'm guessing, reacted to probably an employer association or trade association request, because many of those traveling construction workers seek out campgrounds near the job site, and they have their own RVs that they bring in and live in. Does it have to do with those occupations being deemed as essential occupations under the governor's order?
Yes. Yep. So they have to be like a medical worker wanting to self-isolate, or a essential construction project or something like that. And it's listed. They have to list that out in the application when they fill it out and get it to us. They have to identify why they're asking for a permit to camp.
Okay, and then
the only one that can approve that is is myself. So it all has to come to me.
Okay, and Brian, are there any other steps at the golf course about, to keep from germs from being passed? I've seen some things on TV about, raising the holes up so they don't pull the flags. Are there any other things like that?
Yep, I've been checking with the National Golf Association and their recommendations, and just so you know that in the Midwest, 80% of the golf courses are open. We consider it important exercise and recreation. Some people hike, some people walk around with a stick and hit a ball. So we want to make sure that everybody has an opportunity to get out, get a little stress relief and fresh air. But we have raised cups so that if your ball hits that cup, it will not go in it. So there's no reason to touch the flag or pull the pin or reach in there and possibly get contamination. So the clubhouse is closed. We're selling packaged food and pop and water, and we did allow carry out beer sales because we were having people carry on alcohol to the course. That this limits, we can control what people are drinking, and before that we were having a little too much go on. So we want to get that under control. So there are numerous measures. The golf carts, a lot of people are walking, which is great. But if they do take out a golf cart, they have to be the member of the same household if there's more than one person on the golf cart, and they are sanitized when they come back before anybody else can use them. So there is a number of things that we have in place to protect the visitors and our staff.
Brian, this is Diane Pate Freiberger. So you are monitoring the Dubuque County run golf courses and campgrounds. Who monitors the other ones? Themselves?
The only public campgrounds are our campgrounds in the county. The other ones are all private, and I don't know who would monitor those. There's Hoot Owl out on Middle Road, and the Dubuque Yacht Basin, which is downtown in Dubuque. Then there's the one out by Cascade. So I'm not sure what the name of that is.
And we have a lot of golf courses.
Diane, this is Tom Beshen. Regarding golf courses, I know that the golf course in Asbury, the Meadows, has issued the same guidelines that Brian spoke about. One person to a cart, do not touch the flag, multiple people on a cart. If you live in the same household, you can buy food or drink at a call-in basis. The clubhouse and the restaurant are not open for anyone to go inside. So I can speak for the Asbury course. I don't know about the other ones, but I'm of the assumption that they're following the same guidelines since Asbury is.
Thank you.
Okay, do we, any other questions for Brian Preston regarding conservation facilities and the practices being used for those facilities that are open? Supervisor Wickham, you serves a dual role as a conservation board member. Supervisor Wickham, any comments?
Yeah, just the board of the conservation board did discuss it on last Thursday and kind of went through the talking points that Brian had mentioned, and so I feel very comfortable that the citizen board has reviewed those and given really good guidance to the staff on how to keep people safe.
Okay, thank you, Brian Preston and Supervisor Wickham. Any other questions? Okay, Brian, thank you for that report.
Thank you. Give me a call if you need anything.
Yeah, if you could just stay on for another minute. I would like to just add that I would like to see us be proactive and get some word out to people that these facilities are open and that we're practicing social distancing and sanitizing and, basically get the rules out so that, again, we send out messages that we want people to be safe at home and shelter in place, but we know that people have to have the ability to recreate and exercise outside. So if we could get the word out that these opportunities are there and that safeguards are in place. I'm not the expert on marketing, but I know we have multiple websites, Conservation Board, Dubuque County, and have we, could we maybe do some kind of a campaign to get the word out to people? That would promote the facilities, but also let people know that these people that are there are not necessarily violating the social distancing regulations.
Yep, absolutely. And on our Facebook page, we've been doing a lot on Facebook on social distancing, trying to give people ideas of where they can go that also they might not have as many people visiting. So, and we do have signs at every entrance to our areas so that if they don't get that out, information, they get it when they get here and can read that before they go out on the trails. I'll stay in in the meeting.
Thank you. All right.
Okay. With that, I turn it back over to you, Chairman, or Chair Baker.
Okay, thank you. Tom Beschen, Chair of the Dubuque County Board of Health. Next up on the agenda is item number 2. Rick Dickinson from the Greater Dubuque Development Corporation. Rick is the Executive Director, and Rick is going to talk about working with local businesses.
Supervisor Baker, can you hear me?
I can hear you, Rick.
Okay, great. Well, thanks to the Board of Supervisors and to the Health Board for the opportunity to be with you today. And I've listened in on the entire meeting, and I appreciate all that you're doing for all the citizens of Dubuque County. So thanks for that. I'm going to touch on just a few things and be glad to answer any questions of the board. First of all, I thought I'd give you an update on the impact of COVID-19 as it relates to unemployment in our market. Yesterday, we received a report from the Iowa Department of Workforce Development about unemployment in Dubuque County. Just a preface of where this information comes from, we receive in the latter part of each month what the Iowa Works or Department of Workforce Development deemed to be the unemployment from the previous month. So for March, they told us that the unemployment rate was 4.1%. Well, we know it's much more than that. And the reason there's a disparity between that number and what we know to be true is that the way the state evaluates unemployment, they really don't know how many people are employed every month. That's done about once a year when they rectify all the records. What they do is mid-month, in this case, I think it was March 14th or 15th, they do a survey of a handful of employers, check on unemployment at those places of employment, and then they extrapolate that and make a projection as to what unemployment is in the county. Well, because that survey was done on March 14th or 15th, that was before there were declarations of closure for hospitality and the way things started to snowball. So you can take that 4.1%, which is basically pre-pandemic, and then look at new applications for unemployment since then. And in the 4 weeks since then, we've had an additional 13% of our workforce file for unemployment. So I think our unemployment today, once the final analysis is in, is between 16 and 17% unemployment and rising. Last week's unemployment, new unemployment applications totaled 1,900 plus. That is about 1,000 lower than the previous month, but previous week. But a typical week would have less than 100 applications for unemployment. So we are seeing the worst unemployment since the early 1980s, when Dubuque had the highest unemployment in the United States at about 23%. That sort of sets the tone for the impact on employment in the business community across this nation, but as it relates specifically to Dubuque. Some of the things that I wanted to report on that are occurring this afternoon at 2, there is a manufacturing alliance meeting that's being managed by Northeast Iowa Community College in collaboration with Kristen Dietzel from our office at Greater Dubuque Development Corporation. By the way, Kristen, who is our Vice President of Workforce Solutions, is our point person on all things related to COVID-19 in our office. At that meeting, they will be discussing how to make sure that in Dubuque, as our employees continue to work at places of employment, whether it's in the service sector or manufacturing, or as they return to work in those places of employment, for the new normal and return to normalcy, that they are safe at work. And there'll be discussions about that, and I'll get into that a bit more later. Also, Greater Dubuque Development just completed a phoning contact with over 1,000 employers in our market, not an email push out or some social media campaign. Got on the horn and actually talked to businesses about a number of things, but in particular, referring them to the help site that is being managed in collaboration between Northeast Iowa Community College, Greater Dubuque Development, the Small Business Development Corporation, and ECIA Business Growth. So in those 1,000 calls to employers large and small throughout the county, we encourage them to go to the helpline, which is 588-3350, for all information available on incentive programs to assist businesses as they struggle with the pandemic. We also, as part of that helpline, that is the referral line for the new Dubuque Initiatives Bridge Loan Program. We've had about 500 companies call that helpline. About 100 of those are specifically directed toward information on the Dubuque Initiatives Bridge Loan. We've had, of those 100 calls, 26 loans and totaling $260,000 have already been made to small businesses in our market, and that continues to grow. One of the things I would suggest to the board and to the Board of Health is that if you have any questions about any employer, about any economic segment within our regional economy, if you want anyone to do grunt work, to get out on the street and to get on the horn, to understand what's going on, to provide information to you, we are at your disposal. We are very connected to the business community. We take great pains to do that. Yes, we use social media. Yes, we use the internet. But more importantly, in the old world, it was face-to-face contact. In this world, it's person-to-person over the phone to try to understand what's going on. One of the things we will be working on, and I think we'll be making some announcements within the next week or so, will be how to have a safe work environment in those companies that are firing up once shut down, or those companies that are staffing up if there were any layoffs. And how can we assist businesses in the screening process? How can we assure that they have the necessary protective equipment, the necessary touchless thermometers, the protocols necessary? How do we work with them to work on social distancing within the workplace? There are a number of companies that are thought leaders in that and implementation leaders in that. And I know I read in the paper this morning of concerns about Hormel. Hormel is one of those thought and implementation leaders in our market, and what they do in Dubuque has really nothing to do with what's done at the slaughter facilities around the country that have experienced significant epidemic of the virus in their workplace. We do have, fortunately, employers like that in our market. I think everybody wants to have a safe workplace. They want their employees to be comfortable. That does also include testing, and I will tell you as a layperson, the surprise announcement yesterday with no forewarning to healthcare that I'm aware of, and evidently no forewarning to your health board or to the Board of Supervisors, is woefully insufficient and reminds me of the rollout of the privatization of Medicaid. That's a personal opinion. I don't know if it's better than nothing. It's dependent upon whether it improves and whether it proves itself. And the very questions that you and your health board asked today are answered. And does it eventually get to our market? I know if you do 3,000 tests a day, we'll have the population of Iowa covered in 3 years. And I don't think that's a recipe necessarily for success, nor do I suggest that everyone needs to be tested. But I think in order for employees and citizens to be comfortable and truly come to some normalcy, we have to be comfortable that that we are not a symptomatic or non-symptomatic carrier of the virus, and neither is a member of our household or member of our neighborhood or member of our workplace, especially if we're standing next to them. So that's what we're up to. I would invite each and every one of you individually or as a group to use us to your benefit, to be a communication mechanism for anyone in the business community. And we are working hard to make sure that, as I mentioned, I think the last time I visited with you, that Dubuque will be the best place in the world to weather this storm. And it's because we are working together with all of our partners, and I think can be more effective than other parts of the country. So I'll be glad to answer any questions you might have.
Any questions for Rick Dickinson?
Good morning, Rick. Supervisor McDonough, thank you for being with us. Can you
Sure.
expound upon what you're doing to contact employers throughout the county and not just in the city of Dubuque?
Sure. We are contacting employers throughout the county. This is a continuation of the work we've done for years with what we call info action, the face-to-face visits using Synchronous as a contact manager, asking the same questions of each company. About 60 days ago, we changed those questions to be COVID-19 specific, and we are making those calls over a year's time of 300 plus employers in the market. When we reached out to that 1,000 plus employers, just to inform them personally of the helpline and the contact information, the 588-3350 helpline. And by the way, that provides the employers information about all local, state, or federal programs available to them. Supervisor Wickham, of course, is involved in that as well from the SBDC standpoint. Once they get to that number, they call the number, then there's triage of the circumstances of the caller, and the caller then is referred to a counselor that stays with that company throughout this and making sure that they're aware of what programs are available and helping them to apply for those programs. When we did the 1,000 calls, we did that in our office with 3 individuals making those one-to-one calls. In Dyersville, we work closely with the Dyersville Chamber, and the Dyersville Chamber actually called I believe it was between 60 and 70 of their members in the Dyersville area. But in all other communities and in unincorporated areas, we made those calls to all employers. Our call list includes our board of directors, our public officials, our investors, our info action call list, our HR action call list, and we also incorporated the Chamber of Commerce members list on those calls as well.
Okay, any additional questions or comments for Rick Dickinson from Greater Dubuque Development Corporation? Okay, thank you, Rick. Thanks for all that you and the organization do for the Dubuque County area as the engine that runs our economic development, and in cases like this is in contact with the employers and making sure that they know that somebody has their back.
Well, I think we all have their back. Not all of us have the time or the opportunity to be in direct contact with them. I think one of the things that we're realizing with this pandemic, this crisis, is that the stronger the relationships we have with each other, the less we duplicate services, the more we're able to focus our energies and resources in any particular direction. That's what serves us most, and if we find any gaps in that through this process, we'll have time to fix it once we come out the other end.
One of the things I am blessed to serve on the Greater Dubuque Development Corporation Board of Directors and the Executive Board, but at our meetings, which of course the face-to-face meetings are on hold for now, but it truly is a diverse group of business leaders, government leaders, labor leaders, community organization, nonprofit leaders, educational leaders. So there is a very broad-based coalition that makes up that board.
It is. It's everybody everybody has a voice and nobody has control, and I think that's the best way to get things worked out. I would like to make one other comment, which I should have made earlier, Supervisor Baker, and that is Dan's point about county services. One of the things that is a gap in this is the bridge loan. The Dubuque Initiatives bridge loan is funded by Dubuque Initiatives, which is a private nonprofit that is Dubuque-centric. Currently, no one outside the city of Dubuque, city limits of Dubuque, is eligible for that bridge loan. We are receiving applications from small businesses outside of the city of Dubuque. One of the topics, in fact, there's a Dubuque Initiatives board meeting this afternoon at 2, will be to discuss that. I do want all 3 of the board members to realize that there is no city funding in the DI funding of the bridge loan. There is no county funding of the DI funding for the bridge loan. That's not to say that there couldn't be, or that any funding from the county or the city wouldn't be included and be specific to any particular geographic area you want us to cover. Right now, it is a loan, not a grant. The conditions of the loan it is intended initially as a bridge loan between applying for state and federal dollars and receiving those dollars. But as we implement it more and more, it's a straight up loan to help the company, the employer, survive the pandemic, being able to pay their utilities, being able to pay their rent, pay their mortgage, and perhaps some salary as well, just to get to the other end. The loan is 0 interest for 60 days. If they do not have state or federal funding that allows them to pay that loan back, it converts to a 3-year loan that is still fee and interest free out to a total of 6 months. And then for the 2.5 years thereafter, it is 1% interest for that 2.5 years with payment at the end of that 3-year period, if not before. So that's how it works. It is not available currently to anyone outside of the city of Dubuque. And I would be open to any conversations with the board if they wish to backfill that for unincorporated or any other communities in the area. I'm not suggesting that should happen. I'm just letting you know what the limitations are of that private nonprofit fund, and we certainly would be willing to roll in any financial support you wanted to provide to a loan program within the same structure, and that structure is the helpline, and then from the helpline it goes to a counselor. From a counselor it goes to ECIA Business Growth, and ECIA Business Growth is reviewing the application and cutting a check within 48 hours of approval.
Okay, thanks, Rick. Appreciate that.
Thank you. My pleasure. Take care.
All right, you too. All right. What's that? Yeah, if it was sent to me, so I'm. All right, we're putting the Meadows information on there about their policies that was sent to us, so we're forwarding that for the purpose of people viewing that during the Zoom meeting. So, all right, next up on the agenda we have our HR, or Human Resources update, and so I'll go to Dawn Sherman, our Director of Human Resources.
Oh, thank you. Let me put a couple of documents up there. So I put together a memo just with some of the outstanding issues that we've discussed last week. So let me share that with you, and then we'll walk through that. And I've made many of our department heads and elected officials co-hosts so they can unmute themselves to contribute also. One of the things that we discussed last week was how employees, the ability for them, are they working secondary employment when they are on a reduced schedule? We also talked about making masks mandatory for employees to be wearing while on the work site, and also looking at requiring employees to shelter in place when they're not working. So I sent that out to our elected officials and department heads, I sent out an email to solicit feedback. And so I did recommend an update to the policy, given some of that feedback. And then I also wanted to share the feedback of the mask. So with the emergency closing, I am proposing to add essentially that the employees would remain on call when they're receiving pay due to a reduced schedule. I know that there are some departments who have already made that communication out to their employees and have utilized that process. I know the roads department has, the secondary roads, but we do have employees who are not working their regular 40 hours, so they would be at home. And so this is just language to say that they are to be made available for work during their regularly scheduled hours. There was support of that from the elected officials, and again, I believe that that has currently been expressed. And I just want to note too that I have not received any concerns from elected officials or department heads regarding this. Employees have been responsive in working, and some of them even working from home. So I'm proposing just adding that one paragraph in there. With the employee mask requirement, there was a consensus that they would not like to see that as mandatory, that they would like to encourage the use of masks. That sometimes a lot of them are talking on the phone. They're already social distancing within their departments. That's why we have a couple shifts in different departments. So the necessity for wearing a mask all day, I didn't have that concern. So many of the department heads and elected officials would prefer that we provide the mask, which we have been doing, but do not make that mandatory. There was a couple comments of we should be encouraging employees as they're in common areas, or if they need to enter other departments, that they wear a face mask, that we should encourage that as well. Do you have any questions on those two issues? I know that was the feedback that I had received from.
Yeah, I'll comment on the mask. I had asked about making, whether we should make masks mandatory. Right now, it's not mandatory, but strongly suggested. That being said, I think in the courthouse, there's very few masks being worn, and I understand that people don't want to do it, but I'm not gonna ask for mandatory, but I have concerns that making it, asking them to do it voluntarily apparently is not going over well. I don't see many masks being worn other than security, maybe a few others. So, but I'm not gonna push for mandatory, but I think it's being ignored for the most part.
The thing is, when you wear a mask and you take it on and off and on and off and on and off to do things, you're potentially contaminating the purpose of it. So,
yeah, there's thousand reasons not to wear a mask. I get it.
Well, that would be one of the reasons people don't like to wear them, that it's on and off, and they feel that what they're doing is contaminating it. And that's something they should be free, I think, to be concerned about. So unless we're going to provide many, many masks, I think that's a legitimate fear that people have. Some people can't wear them because of anxiety issues. There are 1,000 reasons, as you say, Chair Baker, but I like that we have talked to everyone and asked them. But when I walk into a department at the courthouse that's door is locked, and I walk through and there's one person sitting in the room and they're not wearing a mask, I'm not upset by that. I have my mask on, so I know that I'm keeping them protected from me. So,
you don't have to convince me. I made my point. I said I'm not pushing for mandatory masks. So I would strongly encourage them.
Dave, this is
Dolan
Diane.
Yeah,
I'm sorry.
Denise Dolan's asking a question. She wants to know who has the masks and have we made any kind of general announcement that masks are available?
I think maintenance responded that they have the mask. They were the ones who had delivered them. I know we have a few up in human resources as well. Those were distributed out, I believe, late last week.
So
Were they distributed out with an email, Dawn, to tell everybody they're available?
I did not send anything. I don't know if when I saw emails circulating about the transportation of them, but they have been distributed to the different departments here.
Okay.
Might need to still make an official communication.
Yep, we can do that. I'll see how many we have left and if we need to pick up some more.
I agree with Supervisor McDonough. Let's get the word out. We got Jason Riker is on here, and looking to see if Chris Soder's on here today. That maintenance has the masks, and of course maintenance covers the West Campus as well. So if somebody chooses to wear a mask and they have issues, there should be no reason why they don't have masks. But that word hasn't gotten out there yet, so it sounds like we're gonna get some word out.
Anything else on those issues?
Okay, any
This is
questions?
Diane Page Freiberger. Just a comment. We do not mandate anyone to wear PPE at all because there's no rule or law in the state of Iowa. There's nothing been decided or actually in the whole United States. But we highly encourage it. And if there are issues like that, such as with anxiety or maybe they get overheated, we have some recommendations, if they want to contact us for maybe making accommodations to being able to do that to protect themselves and to others. It's more for the protection of others when they're wearing the cloth masks. But there are companies in Dubuque County that are mandating their employees as part of employment to wear those masks.
Thank you, Diane. All right, any other questions or comments?
I also want to give an update on, with implementing the policy on March 14th, we added some pay codes to be able to track any pay or leave associated with COVID. So I haven't had time to really break down. This is only 3 weeks worth of data that I have presented here to you. We will have more next week as we finish the payroll this week on our end and be able to pull those reports. But I just wanted to at least give you a snapshot of how employees are, or how we're utilizing the leave, the sick leave, the reduced schedule. And I do want to be able to show that because I believe both of those have changed since we started this. We had a lot more COVID sick at the beginning, I believe, when we were having travelers isolated for 14 days. We obviously are not experiencing those instances as much anymore. So I just wanted to at least put it out there so you can see what some of those hours in. And again, this is for a 3-week period.
Okay, questions for Dawn on this matter?
And again, I think I have all of the department heads and elected officials. If not, I apologize. The ability to unmute themselves if they would have any comments as well.
Okay. Anybody wish to question or comment?
Dawn and McDonough, I'd like to see this be updated. So it's through April 3rd. I'd like to have this come back before us periodically to see if any of these things are changing. At some point, we'll need to, depending upon the duration, we'll certainly need to have some conversation about the length of time. Some of these things might be, you know, I don't know how many employees are actually here. Number of payments, is that an employee or pay period?
On that report,
So,
it would be
right.
an
So,
employee, but they may have it for 2 pay periods. So they
correct.
would count twice on
So, right. So when we look at the COVID regular, I don't even know for sure what we want that to be. So all work performed that is non-COVID related, we've made 8 payments. I mean, I guess I don't want to get into micromanaging this, but looks like we paid $166,000, right? Pay amount related to COVID. Is this helpful to report out to the public? Is this for $4,700 for folks who don't have childcare? I guess I'd like to know, are we assisting people in finding childcare? Is that just one person? Is it 3 people? Are there extenuating circumstances? Again, I don't need to know that, but if you are showing us that that's a financial issue, let's update it and see if it's a continuing trend that we need to look into further, or maybe it's fine and it was we're moving past this.
I agree, Supervisor McDonough. We only have the 3 weeks worth of data right now. We're processing the payroll that it would be paid through April 17th currently. So I will be able to access that information and look at that early next week. So we would be able to see the child care, if people are still utilizing that, or if that was really utilized at the beginning of this when they were calling off school and they needed some time to organize their child care. So that is time that employees requested off because they were unable to secure child care, and we can look to see if we've had any of that usage in this last pay period.
Right, and I don't need to see this next week updated. I'd like to see it maybe through the end of the month to see. Otherwise, I think I don't want to micromanage this in terms of, does somebody have child care? They're clearly, it's an upheaval in anyone's life to lose child care.
This is Chris Kirsch from Sunnycrest Manor, and I would...
Good morning, Chris.
Good morning. I would respectfully ask the supervisors to reconsider the all other medical-related absences being paid under COVID sick. We're having employees call in sick and not having to use their benefits. In times where they're presenting with symptoms of what we consider under the Iowa Department of Public Health, we send them home and that's under COVID sick. But if they sustain an injury outside of work, if they're calling in for other unrelated, unspecified symptoms, they're getting paid and not having to use their benefits, and it's becoming as if they're sharing that information, let's just say.
So it's an easy way out.
Yes.
Right. So Dawn, Chris, I think you raise a valid concern, and I guess, a citizen, somebody looking at us to do supervising would say, hey, that you got potential for that in all of this. So maybe if you've got, those are HR concerns specific to each department and your building, then Dawn, I'm sure you're willing to work with those folks individually to bring back something to us that reflects what we were really after.
And I have had this concern from other department heads, more that it wasn't being abused yet, but it has the potential of doing that. So yes, we can look at that to see. And again, this is just a snapshot here. I'd like to see if that utilization is going up, if it's coming down. and then make a recommendation based on that. So there have been others who expressed concerns regarding the COVID sick use.
Okay, well, please bring it back to us. I don't have any other questions about it.
Chris Kirsch, Dave Baker here. I did raise this issue in our discussions, that and pre-scheduled vacations. So it's good to hear feedback so that we can, adapt. Do you know if the usage of non-COVID-19 related sick leave is higher than normal? And it sounds like you're concerned that word is spreading about the action that we took previously.
Yes. It seems to be, I'll be anxious, and I do want to make the supervisors aware that Dawn and I have had many conversations about this. This is not the first time Dawn is hearing from me about this, but it just seems to be more prevalent when we're asking and doing our assessments, and oh, it's not that, it's just this, and then they're getting 7 days off paid because those are the guidelines that we're under. So it just seems like the conversation is being shared now that one paycheck has been delivered, and they're sharing that information with other people.
Okay. Thank you for that.
Dawn, it sounds like that's a concern that we do want to be on. So maybe looking at that particular issue, addressing that for Monday, so we could take action to change that. That might be helpful. I'd like to be more responsive than letting that just go to, the end of the month, or do we see it as a growing trend? If there's something we should tweak right away with regard to that, I'd like to get that done through formal action on Monday.
If it would be okay, I will look to see, because again, I want to have the information through April 17th that we're currently working on. And so if I'm able to get that by Friday, I will be able to look at those numbers and share that with department heads and elected officials and bring that Monday. But if I'm not able to get that information out of the system, if payroll isn't that far along, it would have to be, it'd most likely be Wednesday then. But it can be next week.
Okay, any other questions for Dawn Sherman or Chris Kirsch? Okay, we'll move on in your report, Dawn.
Okay, I want to share, find my document here. So I have been working on putting together a communication piece to employees if we were to have an employee with a positive COVID-19. And so I was able to share this document with those who would play a role in executing this incident response and receiving feedback from them. And then obviously, I think you saw, or hopefully you're able to see the email that was sent out to all the department heads and you as the board yesterday evening. And so wanted to take a look at this. We've also developed a separate one specifically for the courthouse. I was able to work with Judge Schubad and the sheriff and his staff for them to all take a look at that, ensured that we're going to be working hand in hand with the court system on how we execute this and providing them the resources that they will need to continue on executing their mission. So we do have those systems in place to do this. One thing that I will note on here that we had questions about is this would be if an employee voluntarily discloses this information to us. We don't have anything mandatory that an employee disclose a personal health diagnosis to us. So this would be if the employee has contacted us and let us know that they have tested positive for it. One thing that we could update on this, if we would want to execute this and maybe expand this policy is that if we suspected that an employee was diagnosed, if an employee called and said, I have to be off, I'm sick, I have something, I'm going to be off for 2 or 3 weeks, and maybe we saw that they were exhibiting some symptoms, we would, if we wanted to, we could execute this, close down, do the cleaning if we suspected it as well. Because I know that was one concern. If an employee just chooses not to disclose that to us, what do we do? That doesn't prevent us from taking action to secure and safely clean the facilities.
Dawn and McDonough, I don't, you referenced an email last evening. I need more specifics. What is the email that was last evening?
What was that?
What is the email that was last evening? What are you referencing that this combined with an email last evening? What is the email? Where is it?
The email contained these 2 documents. Were you able to?
Yes, you sent it to us yesterday.
Yeah, I was just referring to the email. That's what I have sent out because that was the first time that some department heads have seen this because we were working on this on yesterday.
So are you still expecting to get feedback from people?
Yes.
Okay, so this is a draft.
Yes, these are both in draft form. And one thing that is important is that we will not disclose the employee's name. That has been stressed on many different websites, and we do not disclose medical conditions of employees. We would have a script just to let them know that they have been in close contact with an employee. So one thing to differentiate here, for example, if the courthouse had an employee who tested positive, we would immediately shut down the facility, clean the facility, work with our Board of Health and their staff to determine when we can open that up along with you in the court system here. But not everybody would be quarantined for the 14 days. It would only be the people who were in close contact with them. And that is that 6 feet for more than, I think the period of time is 15 minutes is what it was within the prior 2 weeks. So there would be, if we were to open back up the facility after that, we would have employees be able to return as long as they did not have close contact with that employee. And I would be working with that employee to determine who those individuals are, contacting them, letting them know what the steps are for self-isolation, if they had anything that, if they had a report, if they could report that to us as well, and we would continue on that process with them.
Right. I'm wondering if there's a problem there because the VNA will also be doing the tracing pursuant to Iowa Department of Public Health guidelines. Putting it out as what our response would be, I wonder if that would be problematic to have those folks give that information to you if they're disclosing it confidentially to public health. Do you think that could be a concern there?
Again, this would be if the employee voluntarily shares it. We're not requiring that because again, that's personal health information. So that would be if they voluntarily disclose that to us, and then that would just be myself and if they had notified their supervisor. But if they notified me directly, I would not even tell their management team who the employee was. But we would make contact with them and ask who they've had close contact with.
Okay, so I see that if they voluntarily disclose, but if they voluntarily disclose to you, but they don't want you to do any further contact other than what the VNA is going to do, would that be a problem?
I don't think, and I don't know if CJ's on or Patrice, I don't understand that would be because we would need to reach out to the employees. I think it's for the safety of our employees to let them know. Again, we would not disclose the name of the employee, but we would want those employees to go self-isolate, and to not tell them, I think, would be put many more people in danger.
Right, that's been one of my points, multiple calls and emails received from people when there is a positive in a workplace and people are required to go to work, the place is still open, there are concerns. So I think this is proactive, and I think we should be looking at this. We've got a couple different versions, and I think it's up to the Dubuque County Board of Supervisors to control these facilities, not the Iowa Department of Public Health or the VNA.
Agreed, and the supervisors have done that. So my question to my colleagues would be, last week we had 420 people during the course of 5 days coming in and out of the courthouse and visit the front of the courthouse. Are we benefiting from that number?
I think, Dawn, on the issue that I'm raising about whether or not an employee would then work with you to do tracing, I guess that's my concern. I think we want to make sure that anything we choose to do also takes into account the public health directive, and that we are sensitive to what they are also doing. I think we want to work with them to make sure that we're not putting the employee in a situation where they're feeling intimidated by us to do more with us than they might otherwise have to do. We don't want to change the employee-employer relationship.
And Patrice had reviewed this, and she had reached out to her contact at the VNA who's leading up those responsibilities, and she stated that they are telling citizens who test positive they're recommending that they share that with their employer. But I can reach out to her and ensure that we're not stepping into their court here. But my goal was to move quickly if this happens and close the facility, get it sanitized, and ensure that our employees are moving quickly to self-isolate if they've been in close contact.
Dawn, I'm sure you're seeing in the chat that we have some of our own employees asking about us some questions. Will you follow up on those individual questions about the disinfecting and you can see that our employees have some concerns about maybe even how they'll know whether or not someone's at risk.
Yes, I'll have to go back and look at those.
This is Tom Beschen. I'd just like to offer a comment that while I don't have an issue with the document, I think we need to remember that there's both the work life and the public life of these people to consider. That would the contact tracing that is being done by the HR department supplement what's being done by the VNA, because these people have a public life too that we need to be concerned about.
I would look at this as only the employees that the contact that we would be doing would be with employees. If we could do the public, if we had somebody at the treasurer's office, I would leave that to the VNA to do that. The employee would be disclosing all of those contacts to them. My main focus here was our employees.
Yeah, I understand that, Dawn, but what I was getting at was the people that employee may come in contact with outside of his work hours.
Yes, that's part of the VNA process, I believe. I remember looking at their questionnaire. That would be something that they take care of, not us as an employer.
Okay, so they would have contact tracing going on 2 levels. work life and outside of work.
Correct.
Okay, any other questions? Sounds like we're looking for everybody to review this, and Dawn, do you know when you want to bring this?
Actually, I could bring this back Monday during
Monday?
our work session.
All right, if everybody will review this, and then we'll put it on perhaps for an action item on Monday.
Thank you.
Chair Baker.
Dawn, I have another question as well. On the previous document, you talked about an employee website. Would these draft documents be something you would place there for employees to see
Yes.
and notify they're in draft form, so we can feel like any of their questions or insecurities about this anxiety, should we want to address this before we just make this be the policy?
Yes, we just have that up and running, so I can share just kind of that screenshot.
And do you have the supervisors listed as, will we be involved in the employee website?
Yes, we just got this up and running. I have not sent anything out to the employees. But this would, the employee will be able to access it. Employees will be able to access it at their homes. We're not doing it where it has to be connected to our network. But we kind of want to do a one-stop shop where they can find some documents. So yes, we would include these on there. We have our public risk, or our public health risk policy up there. And we'll be adding to this as things come out, and we want to share that information with our employees.
Right. And, I know I'm harping on this, but it doesn't say that we are asking people to stay home as much as possible. It just says stay home if you're sick. I understand this is the Iowa Department of Public Health position, but that is not the position of the 3 elected supervisors. During this pandemic, take steps to remain safe. Number 1, stay home as much as you possibly can.
We can add that bullet point.
I don't know, Jay and Dave, what you think about that? You always soft step to stay home if you're sick.
I think
this is in its infancy form. It's still developing. We want to put out the Test Iowa information out there. So if you have ideas, if you want some information shared, we can get that up there very quickly.
Right, but it's still this way even on our own website.
I believe that we, the Board of Supervisors, have really bent over backwards to encourage people not to come in. We're paying them to stay home and not making them use their sick leave or vacation. So if someone, I think we have to have a plan in case somebody, for whatever reason that I can't understand, comes to work sick and is infecting other people. I think we need to take steps to protect the other people who have to come to work in the courthouse. And close the courthouse if necessary for sanitation, et cetera, if that happens.
I assume my colleagues have heard of asymptomatic people, citizens.
Yes.
So they might be in the courthouse today with you.
I agree.
So I wouldn't wait till they're sick and showing symptoms. That's a failed approach.
Understand your position, Supervisor Wickham. Thank you.
That's all I have for today.
Okay, that's the end of Dawn's report. So I guess there were some good points raised. Let's everybody review the documents over the weekend. They'll be available on the website, and we can perhaps take action on Monday. Okay.
Chair Rager, we do need to discuss the meeting time for Monday.
Okay.
If it's, so your regular meeting is at 5:30. So I want to look for guidance if you would still like to hold this at 10 a.m. or would you prefer to have it in the afternoon so your meetings go back to back? Just some guidance on what time you're looking at.
You know what time our first work session, other than the COVID-19?
We have Anthony coming in at 4:45, and we do have the mental health one, which we have at, I think, 2, because I was looking at maybe putting you in from 3 to 4:45. But we can move that at any time. I mean, so we do have 2 other work sessions, Anthony's work session and the mental health one so far.
Okay. I would, I guess I'd want to hear from Tom Berger and Patrice about, moving the time of the work session, and Chairperson Beshen for the Board of Health, and kind of make this a group decision. I think the supervisors are, I believe, flexible. If we can't come to a consensus, I would say we go at 10 o'clock and then get back together whenever, because we've, the meetings are, we're not getting them done in an hour, hour and a half. And so I think, we should leave a 2 to 2.5 hour block for these meetings, just to make sure that we have enough time so we're not rushing this meeting, nor, infringing on other scheduled meetings. So if we have a 4 o'clock meeting, I would say the latest we would go would be 2 o'clock, and possibly think about doing 1 o'clock or 1:30. But I want to know if that conflicts with Tom Berger or Patrice Lambert, or any of the other folks involved, Tom Beshen.
I do know that Patrice and Tom, I don't know about Tom Berger, but I believe they're on their daily call right now. As far as my schedule goes, I could do 10 o'clock or 1 o'clock. It doesn't make a difference to me. But I know Patrice had to leave for another call, and I don't see Tom Berger on the line anymore.
Okay.
This is Diane Tate Freiberger. May I make a comment? Dr. Bobby Canero, who is on the Board of Health, that is our liaison, our medical liaison, is unable to attend meetings during the daytime, and he would like to participate in some of the meetings. And that was brought up the other day. I thought it was going to be brought up by the Board of Health. But when we're taking a look at even if one of the meetings through the week, he said that he's in clinics every day. So it would almost have to be an evening meeting for him to be able to participate. And I think he adds a valuable part of the Board of Health.
Well, the Board of Health can schedule any meetings you want at any time. You could go ahead and still have an evening meeting with the Board of Health. We're not taking that away from you.
I understand, but we're already committed to 2 meetings a week with the Board of Supervisors. A third meeting, we are dealing with a group of volunteers and people who have other schedules they have to maneuver.
For Dawn, do you know if we have a heavy meeting schedule? I think there's merit to doing an evening meeting, perhaps after our 5:30 meeting. We have done special meetings in the past, 6:30 or 7 p.m. I just wanted to kind of get an idea if we're looking at an hour meeting or an hour and a half meeting.
Rhodes just sent, there's not much on the agenda when I looked at, but I have not done a whole lot. Let me see how much Rhodes has.
I think we have a few zoning public hearings.
Yeah, I need to check. He has receipt of bids, a public hearing on Bobcat Road, the speed limit there, and just a few resolutions. I would say I need to check with zoning, which I don't think they've been doing a whole lot.
So if we were to schedule a meeting, and our intention would be to start after the Board of Supervisors official meeting. In putting the time down, if we say 6:30, my understanding is if we get done at 6:15, we have to wait till 6:30.
That's correct.
Can we post it as no later than 6:30, but would start immediately after the Board of Supervisors meeting? How would we word that?
You can always start late, you cannot start early, is the direction that,
So if we said, okay, we'll schedule it for 6:15, then we could, if it starts at 6:30, it's okay, but again, we can't start early, I understand.
correct.
So,
We do have 3 zoning cases and 1 plat
okay,
in there, so I would recommend probably 6:30, maybe at the earliest with those.
I'm fine with doing an evening meeting. I guess I'll defer to Ann and Jay for their input.
Where else would we be?
Yeah, and it might allow for more folks who are working in essential jobs during the day to participate in the meeting. I guess we won't know that until the actual meeting, but I think it's a good suggestion, and
I would leave it up to the chair to make the decision and call the Board of Supervisors into session.
Agreed.
Okay, I'm gonna.
You don't need 50 people to figure this out.
Right, okay. I wanted to get input. We'll schedule it at 6:15 p.m. And then it'll start either at 6:15 or whenever the Board of Supervisor meeting finishes up. Okay? Any other questions?
I have another issue. Yeah, I do have another thing I'd like to address. When do we expect that the agenda and the board packet is going to be published?
Deadline was noon today, and I'll be honest, I have not looked at any of it really. So the pre-COVID, it was always, the goal was on Thursday. Mary said noon tomorrow.
So I won't be expecting to find anything on Sunday afternoon? Sunday night?
We would, so when we set the agenda's set, but we do have it on there that the packet itself can, sorry, I'm gonna take this off. The packet can be added to, but you cannot add an item after the agenda has gone out, is how we have it on our wording on there.
Okay. All right. Any other questions? And I think, then I think we would be in line for adjournment because we have a meeting on Monday.
We adjourn,
Yeah,
so.
I think the proper motion would be to.
I will make a motion to adjourn.
Second.
Okay, motion made and seconded to adjourn. Any discussion? All in favor signify by saying aye.
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 Carried 3-0. Meeting is adjourned. Thank you.
Thank you, everyone.
Goodbye.